What is the history of diverticulitis treatment? Have you ever wondered how diverticulitis treatment has changed over the years? The journey of managing this condition reflects significant advancements in medical knowledge and practices. In the past, diverticulitis was often treated with aggressive surgical methods. Doctors were particularly concerned about serious complications like perforation and peritonitis. Early guidelines suggested that patients over 50 should undergo elective surgery after 2 episodes, while younger patients might need surgery after just 1 episode. This was based on the belief that recurrent attacks would be more severe and harder to treat with medications. However, in recent decades, the approach has shifted dramatically towards more conservative management, especially for uncomplicated cases. Nowadays, mild diverticulitis, which does not involve systemic inflammation, is often treated with bowel rest, increased fluid intake, and symptomatic care. Interestingly, routine use of antibiotics is not always necessary, as studies have shown no significant difference in outcomes between patients treated with antibiotics and those who are not. For complicated diverticulitis, such as cases involving abscesses or perforation, treatment has also evolved. Smaller abscesses can often be managed with antibiotics and percutaneous drainage. In contrast, larger abscesses or cases of generalized peritonitis typically requiring surgical intervention. A notable advancement in this area is laparoscopic lavage, a minimally invasive procedure developed in the late 1990s. This technique allows for washing out infections in the abdomen and has been extensively studied over the past decade, showing benefits in specific cases. Dietary recommendations have also undergone significant changes. In the past, low-fiber diets were commonly advised during flare-ups. However, current evidence does not strongly support these dietary restrictions for improving outcomes. Some studies have even explored the use of anti-inflammatory medications like mesalamine to reduce the risk of recurrence. While some guidelines in countries such as Germany have started recommending mesalamine for uncomplicated diverticulitis, this remains an area of ongoing research. In summary, the history of diverticulitis treatment has evolved from a focus on early surgical intervention and routine antibiotics to a more individualized and conservative approach for uncomplicated cases. Surgery is now reserved for complicated cases. Advances in imaging, minimally invasive surgical techniques, and a better understanding of the disease's natural history have all contributed to this evolution. Today, managing acute flare-ups involves a careful balance of medical therapy, monitoring, and surgical options when necessary, tailored to each patient's unique condition and risk factors. Always remember to consult healthcare professionals for personalized advice and treatment options.